If you've heard the terms like PTSD and ASD thrown around, but you're not 100% sure what it means, this video is for you. By the end, you'll have a much better understanding of the two different diagnoses. In this video, we're going to cover what is PTSD and ASD, what do they have in common, symptoms of ASD and PTSD, the key differences between the two, how ASD and PTSD are diagnosed, and treatment options. Hi everyone, I'm Ashley Phillips and I'm a clinical counselor with over 10 years of experience. Over the years, I had worked with many clients with PTSD and ASD to help them overcome and heal from their traumatic experiences. On this channel, I talk all things about trauma, my experience in private practice, and my favorite modality, EMDR therapy, which is a fabulous therapy to treat trauma. Okay, so let's start by defining PTSD and ASD. PTSD is short for post-traumatic stress disorder. It's a mental health condition that develops as a response to witnessing or experiencing a terrifying or traumatic event. ASD stands for Acute Stress Disorder, not to be mixed up with autism spectrum disorder, but it's also your body's response to a traumatic event. They are both clearly defined in the DSM-5, which is the 5th edition of the Diagnostic and Statistics Manual of Mental Disorders. PTSD and ASD are both a response to a traumatic event. And we're talking about the big T trauma stuff here. So exposure to actual or threatened death, serious injury, or sexual violence. Exposure can be direct, as in it happened to you, or witnessed if you saw it happen to somebody else. Having repeated exposures to adverse details of traumatic events, such as by first responders, also qualifies. A person with ASD and a person with PTSD can experience many of the same symptoms. These can include recurring and intrusive memories of the event, distressing dreams, sleep disturbances, intense psychological distress, the inability to remember key aspects of the traumatic event, dissociative reactions and flashbacks, avoidance of memories or reminders of the event, as well as anger, irritability, detachment from others, and the inability to experience positive emotions. This isn't an exhaustive list by all means, but it's going to give you a pretty good idea. So let's recap. We've learned that PTSD and ASD are both a response to a big T trauma, and they both largely have the same symptoms. In both cases, the nervous system is basically saying, that was too much. I don't know how to make sense of what just happened. So what's the difference then? The key difference between PTSD and ASD is when and for how long the symptoms are exhibited relative to the traumatic event. In the first 3 days after the traumatic event, it's considered too early to establish any sort of diagnosis. However, a person exhibiting the aforementioned symptoms 3 days following the traumatic event can get diagnosed with acute stress disorder. Think of it as that the body and mind are still trying to make sense of what just happened. It's like an acute injury. It's fresh, raw, and still in the healing window. Sometimes the nervous system will settle down over the course of the first month after the traumatic event. But if left untreated, 80% of the people initially diagnosed with acute stress disorder will continue to exhibit symptoms for more than a month. Now, if symptoms persist for more than 1 month following the traumatic event, you would then qualify for a PTSD diagnosis, which is more like a chronic condition. It's like the nervous system is still stuck in survival mode as the brain keeps sending signals that you're in danger, even when the event is long over. That's why I believe it is so critically important to seek out treatment shortly after the traumatic event so that you can greatly reduce the chances of developing PTSD. I do want to say that it's not always that you're going to exhibit symptoms right away after being traumatized. In about 25% of PTSD diagnoses, a person will have what's known as delayed onset PTSD. This is where PTSD symptoms appear after 6 months or longer following the traumatic event. In these cases, there's usually some sort of trigger in the form of a stressor, some reminder, or another traumatic event that's like the proverbial straw that breaks the camel's back. Now let's talk quickly about how acute stress disorder and post-traumatic stress disorder are diagnosed. A diagnosis is typically done by a psychologist, psychiatrist, a family doctor, or clinical registered social worker. The key word is clinical RSW, not just an RSW. We already know that there needs to be an exposure to actual or life-threatening death, serious injury, or sexual violence. We went over some of the common symptoms that people experience after a traumatic event, and a number of them have to be present in order to make a positive diagnosis. These symptoms need to cause significant distress or impairment in a person's life, and they cannot be attributed to another medical condition or the effects of medication, drugs, or alcohol. I may do a whole video on the diagnosis of ASD and PTSD, so if it's something that you'd like to see, let me know in the comments below. Treatment for PTSD and ASD is basically the same. Therapies like EMDR, ART, trauma-focused CBT, or somatic approaches can help the brain and body process the traumatic event properly, so it stops feeling like a constant threat. There's also some really promising results with the use of psychedelics like MDMA, psilocybin, ketamine, DMT, and LSD in treatment of PTSD. But I really want to highlight and underscore that their use in trauma treatment is still in the early stages, and all substances other than ketamine are illegal in Canada and in the US as of 2025. I also want to emphasize that the use of psychedelics for treatment of trauma symptoms needs to be done in a controlled, medically supervised environment. Self-administering on a Friday night is definitely not the way to deal with trauma. If you want me to do a video on the current state of research on the use of psychedelics for PTSD, let me know in the comments below. So let's recap. Both acute stress disorder and PTSD are your body's normal responses to trauma. Both have similar symptoms. The big difference is that acute stress disorder is something that you can be diagnosed with between 3 days and a month after the traumatic event, while PTSD can only be diagnosed if it's been more than 1 month since the traumatic event. Trauma therapy, and EMDR in particular, is the recommended way to treat ASD and PTSD. Hopefully now, after watching this video, you'll have a better understanding of the similarities and the differences between acute stress disorder and PTSD. If you found it useful, please give this video a thumbs up because it helps others find this information. And if you haven't yet, please make sure to subscribe to this channel for more information on trauma treatment, EMDR, and the realities of life in private practice. See you next time.